Okay, so now I have the pleasure of introducing our next speaker, Dr. Helen Eyles. Helen is a public health researcher and senior lecturer at the University of Otago, and her research focuses on environmental and policy aspects and looking at how we navigate real food in the context of today's food environment. So Helen's talk today is looking at our food supply and enablers and challenges to just eating real food. So thank you, Helen.
Thank you, Mickey. And I think Mickey must have had on her mind when she introduced me to this talk that we first met when we were students down in Dunedin, because she introduced me as from the University of Otago. But you did. But actually, I'm now at the University of Auckland. So better just put the credits in the right place. But Mickey and I originally met, I don't know, it must have been about maybe 15 years ago now, so it's really nice to be here, and I really feel privileged to be amongst some amazing people and some amazing speakers, so I hope I can do some justice to this topic for you all. So just to orient my talk a little bit, last year I was lucky enough to take part in the public health leadership course that the Ministry of Health run, and during that course we were asked to think about what our vision would be in our particular area, because it was a broad public health course, and my particular vision was for real food to be accessible and preferred by all New Zealanders. So that's where I'm going to orientate my talk to today. So I've got three key points that I'm going to cover. First, of course, what should we eat? And thankfully this aligns with the last two speakers, so I feel quite relieved about that. Look into a little bit about our food supply and whether it's consistent with this, and what are the barriers and enablers in that space. And then what can we do about it? And I've tried to also orient my talk a little bit to the theme of the conference, so thinking about looking back and moving forward, what can we do in a different way than what we've done in the past that hopefully might be a little bit more successful. So just looking back into history, I'm sure many of you in the audience would be familiar with Hippocrates here, a very wise saying, "Let food be thy medicine and medicine be thy food." And I think that was a really wise saying way back in 400 BC. But I guess it may have led to us thinking about nutrition largely as a biological science. So we know from about the 1900s, when we started to study nutrition, we studied it in a way that really reduced foods to nutrients. The idea, of course, was to improve health, and I guess thinking about nutrition in this way, it's really had a major influence on how nutrition has been taught, and it certainly had an influence over the way that I learnt nutrition in my undergrad years. There were some major achievements during this time, of course, so we figured out some of the major nutritional deficiencies. We did a lot of work with undernourished populations, and we managed to remove some of those nutritional deficiencies from those populations. There was also a lot of nutritional epidemiology going on at that time, which is a really complex science and is quite tricky, and I think has led to some of the confusion that we now have about what we should be eating. But it's also led to, of course, some really good dietary advice as well. And then moving on sort of into the 2000s, we started to think about nutrition as more than just a biological science, and we started to think about the social and environmental aspects of nutrition, which I guess were always inherent, but they were not something that we always considered when we were studying it. So all of this has almost led us to be a little bit confused, or many consumers, maybe outside this room in particular, are confused about what they should be eating. And nutrition is a very complex behaviour. It's not like smoking, which is kind of a yes or a no. Even physical activity is a yes or a no, or it's at a certain level. We all know we should be doing it, but nutrition is something that we all do, generally at least 3 times a day, and we can do it in so many different ways, and there are so many different competing drivers and enablers and barriers towards us doing it well. So what should we eat? And of course, as a scientist and academic, I like to come back to the evidence, and thankfully this fits in well with the last talk. So I really like to come back to this review by David Katz, and the reason I particularly like this review is that it's quite independent. So David Katz is a Yale MD, and he took the evidence around what types of diets people in these blue zones were eating. So they are, of course, the areas around the world where people tend to live the longest, healthiest lives. And of course, it's not all about diet. There are other features of those particular lifestyles that probably mean that people live longer. But let's just think about diet for a minute. So he took the evidence, and of course, as you can see across this kind of yellow bar here, there are all different types, really, of diets consumed by these populations. But there were some key features that I think lead into the talk. And the key features of these healthy diets were that they were low in refined carbohydrates and low in added sugars. And they really focused on whole foods and generally plant foods as well, actually, with some addition, of course, of proteins, of meat-based proteins, if that was, I guess, acceptable for the population. And what it comes down to is food, not too much, mostly plants. And that's Michael Pollan's saying, and I really do love that. So if we're all aiming for this vision of everybody eating whole food, but we're trying to do it, and which is our global food system. It's quite complex, right? So we as public health nutritionists are trying to work in this space, and we're trying to figure out how we can improve people's diets in this really complex space. But what we can do is think about what the barriers and enablers are within this space, and maybe what are some of the levers that we can pull to encourage people to eat more real food. So let's just break down that big complex diagram into parts. So if we start with the consumer, which was where we often tend to orient ourselves, and of course when consumers are making food choices, they tend to make them based on so many different things. But if we just think about individual aspects for a minute, things like taste, habit, palatability, our cultures and beliefs, these are really important in terms of making our food choices. But as a public health nutritionist today, I'm going to put those aside. I'm not saying they're important, but I'm just not going to focus on them for my talk today. So just keep them in the back of your mind. So let's move on to the first part of that diagram, and this is our food chain. So this is really where we're thinking about the inputs in our food chain. This is growing food, so it's not just about growing animal food, but also plant food. We have inputs, we have land that we need to grow that food on, we have food that we need to feed the food that we're growing, and of course all of this results in available foods and nutrients. So what I'm going to take a quick look at now is just a couple of examples of available food and nutrients. Is what's available in our food supply encouraging us to make real food choices? So let's start with a little bit of New Zealand data. This is similar to the FAO data that was presented in the last talk. It's food balance sheet data for New Zealand, and what it shows is, this particular slide shows the availability of fruit and vegetables in New Zealand per capita. And it's not the newest data because it's actually not available, and I'm hoping to get a student, if anyone's keen, to do something a bit more recent. So this takes us up to 2002. But what we can see there, if we look at this is total fruit and vegetables, and we have somewhere between 800 and 1 kilogram, 800 grams and 1 kilogram available per person in New Zealand. I don't imagine that's changed too much. And if we think about an average serving of fruit and vegetables being somewhere around 80-90 grams, we have availability of about 10 servings of fruit and vegetables for each person in New Zealand. So that would be, to me, an enabler. Just setting aside for a minute those other things like accessibility and cost, etc. We're just looking at availability for now. That would seem to be an enabler in our food supply. So that's really positive for New Zealand population. But using these same types of data, we can look at other nutrients. So this is total sugar and sweeteners available in our food supply. And it only takes us up to 2002. So I can imagine if we think about that trend continuing on, this would be probably a major barrier in terms of what's available and the ability to us to eat healthily. So what I'm doing here is just kind of I'm just scratching the surface. I'm not covering all the evidence at all. I'm just kind of putting some ideas out there. So if we now move to another section of that food supply diagram, we think about the value chain. And this, of course, is a really contentious area and makes many of us feel a bit sweaty and uncomfortable, because this is where we take that real food, not we personally, but we take this real food as a society and we turn it into something else, and we add value to it that increases profitability for big food, for example. So in this part of the food chain, we're basically taking we're taking those raw inputs from the agricultural part of the food chain and turning them potentially into something else. And depending on how much processing we do, food becomes potentially less and less healthy. So let's take a look at what this value chain has done to our food environment. So looking at local food environments, and I like to take the supermarket because I've done quite a lot of work in supermarkets, and it is where in New Zealand we purchase about 60 to 70% of our food from supermarkets, and that's actually decreasing over time. But let's just think about the supermarket for a minute. And there's really good evidence from supermarket research studies showing that the way the supermarket is set out, of course, and the shelf space that's allocated to real foods versus processed foods is unbalanced. So we're really encouraged when we shop in that supermarket space to make an unhealthy food choice. Of course, there are all sorts of marketing and pricing promotions that go on in that space as well. So we have, looking at specials and promotions, we know that the majority of food that is promoted is unhealthy and doesn't tend to be, the real food, because there's not that space to move in terms of the markup and the ability for farmers to make money from it. So that's really tricky. And we know also from some work that we did recently in New Zealand supermarkets, we applied the Monterio classification system that was mentioned in the last talk to foods available in New Zealand supermarkets. And just thinking about only those packaged foods, what we found was that more than 80% of anything in a packet was ultra processed. So it was right down at the end that is not what we're aiming for in terms of our vision, or if you like, for what we should be eating. And of course, food prices are really used to the advantage of food manufacturers in quite a scary way. So we know that price instruments like bog-offs, which are buy one get one free, really encourage consumers to buy more and more of the products that we are hoping they won't consume. So they can increase sales by up to 3,000%. Which is quite scary. And I'm sure if you work in that kind of space, you would know us public health nutritionists don't actually have access to a lot of these data, that if you're working in the supermarket space, you probably would. We know that foods of a lower nutritional value are generally more expensive. And of course, there's a whole science around how we decide that in terms of what unit we use to determine health. But just generally, foods that are healthier are more expensive, and because of that, they tend to be selected more by lower socioeconomic groups because they're more price sensitive. These are acceptable diets in terms of food security, so it's around thinking about not just a nutritionally acceptable diet, but also thinking about a culturally acceptable diet, a socially acceptable diet. And those types of diets are associated with higher costs for people, and that those living on low incomes really don't have enough money to be able to eat that acceptable diet and to do that well. So that's a barrier. Now thinking to politics and governance, which is a reasonable area of passion of mine. So a lot of the work that I like to research and to do is focused around policy relevant interventions. So of course this can be a barrier or an enabler for people, depending on how these different policies are set up. So let's take a look at a couple of examples. So this slide shows some of the food taxes and subsidies. Might be a little bit hard to see, but some of the most recent food taxes and subsidies around the world, and these ones are generally focused on junk food and soft drink taxes. And the one that's been in the media just recently, so these are intended, if they are put out by the health section of the government, they generally are intended to be enablers to eating real food for people. There are some arguments around regressivity with these types of things, but actually, if one is to think about the benefit that the area of the population receives that has the lowest income, they receive the highest health benefit. So I think that argument of regressivity is really, I don't think it's that relevant. But just looking at all of these different food taxes and subsidies that have come in and thinking about the pressure of the food industry. So one of the things that's been really topical of late is this Mexico tax. So over here in Mexico, they have recently had a sugar sweetened soft drink and junk food tax put in. It wasn't as high. They actually initially wanted to put in a 20% tax. It's come out at a 1 peso per litre sugar sweetened beverage tax. But recently there's been so much pressure by food industry against government that they've actually halved this tax on any sugar sweetened beverages that have less than 5 grams of sugar per 100 mils. So this is the kind of environment that we are trying to make a difference in, whereas food industry tend to win. And I was actually thinking about Julianne's talk yesterday around climate change, and I was thinking you could almost just superimpose my talk over the top, because it's really, I think everybody here agrees we should all be eating whole food diets, real food, and everybody, or most people would agree with Julianne on the climate change issue, but we are fighting against some really big pressures here from big food. Another thing that's really impacted our food supply is this thing called agricultural subsidies. And this is more of a global food supply issue, because down here in little old New Zealand, we're a little bit isolated. But of course, because our food supply is global, we are affected by the price of foods that are coming from other countries and our ability to trade with them. So this slide shows direct subsidies for animal products and feed across the world. And you might think, actually, some of these subsidies are not too bad. So farmers receive a subsidy just for growing these types of foods. So we have in South America beef and veal. In Europe and the UK and different areas we have meat, milk, poultry. And we might be thinking, well, those are real foods, so that's pretty good. But where we, and I don't have a slide on this, but where we run into trouble is where we think about, actually, are we giving farmers subsidies for growing fruit and vegetables in a sustainable way? I don't know of any subsidy in that area, except to mention the corn subsidies in America, which have been in place for a number of years. There's huge pressure to keep them in place, and that's resulted largely in the reason why we've got so much high fructose corn syrup in America, because when sugar became more expensive, they replaced it with high fructose corn syrup because, of course, there was an agricultural subsidy for farmers to be growing this particular product. So this is just touching on some of the barriers and enablers in our larger food system. And I guess that kind of takes me to the next point in what I wanted to cover today, which is what can we do about it? And in thinking about what we can do about it, we can come back to this old Jeffrey Rose principle, which is population versus individual strategies. And as a population nutritionist, population health nutritionist, I like to think about, I guess traditionally we've been encouraged to work on population strategies, which many of you will know is about moving this curve here slightly to the right or the left or in the desired direction, which is really important, and that's where we tend to get our biggest economic benefits from. But where I struggle a little bit with this is thinking about what that does is it makes everybody quite homogenous, and it gives us a implementation strategy or an intervention that treats everybody the same, and that tends to increase equity often depending on the intervention that we choose. And I think sometimes thinking about actually what works for the group that needs it most will probably work for everyone. So I think this is, it's an area I struggle with, and I'm never quite sure which way to turn in terms of where we can best spend our public health dollars. And a good example of this, of course, is processed food, which is an area I've spent quite a bit of time researching. So of course, in an ideal world, we would all be eating real food, but in reality, we know that a lot of people, so that on average, in high-income countries, consume about 70% of the energy and nutrients from processed food. And what the problem with this is, of course, is that it's got that refined carbohydrate, saturated fat and sodium kind of all combined in one, which is just awful for health. And we know that people are time poor and there's so many other competing interests for them. And they tend to make this processed food choice. So I'm just going to take you through a couple of examples of research that we've done in this space, and I'll try to do it a bit quickly since I haven't got a huge amount of time. So just thinking about food pricing, we did a trial basically giving people either discounts or education for 6 months. And what we found was that the education made no difference, but the discounts encouraged people to make healthier food choices. And that even happened once we had taken the discounts away. This moved us on to do some work in food price elasticities, which is looking at the percentage change in consumption that people make when there's a change in price. And so what we found is that, of course, the more for price elastic foods like soft drinks, we could do a 10% change in price and we would get about a 12.5% change in consumption. So that's quite powerful. We've also looked into food labelling, and just taking aside for a minute what is the perfect food label, one of the great things that food labelling does is it encourages reformulation. So it encourages taking some of that sort of sugar and sodium out of packaged foods. It's not really what we want people to be doing, but it's a step in the right direction. I'm just going to flick through a bit quickly because I want to get to the end part. Okay, because I'm running out of time. And so I think that kind of covers where we've been working in this space. But thinking about where could we go forward, we seem to have been scratching the surface. We're encouraging people to eat healthier packaged foods instead of actually eating real food. So one of the ways we could look at this is taking more of a systems approach. And I've stolen the slide from Boyd Swinburne and he told me I could have it. And he likes this intervention house. And what I like about this is it's thinking about interventions need to be multidisciplinary. We need to be thinking about all different types of interventions at all different areas. So we need community interventions, but also high-level interventions. We need governance and politics. We need to be attacking this from basically all sides of the issue. And this brings me, I guess, to systems approaches, which many of you would have heard about. So rather than working on the food environment, which is what we have been doing in the past, it's thinking about working on the system. So it's about working within and upon existing systems to improve them. So thinking about paying attention to what the building blocks of that system are and implementing processes that can improve that and improve some of those levers. It has very high external validity, and I think the idea of systems approaches is that we can get a much bigger change in a much shorter space of time. So it's kind of thinking about working on some of these arrows rather than working on the actual things themselves. We're working on the processes, if you like. And one of the places we can start is local food systems. So what we're doing in local food systems is we are looking at geographically local production and distribution, supporting local economy, which tends to produce jobs. And it can also be a much more environmentally and economically sustainable way of working. And it fits really well with improving food security as well. So what can we do in our own backyard in terms of food systems? So there are some examples coming out of New Zealand and also other areas in the world. So New York has this quite fantastic system that they've set up called FoodWorks. And what they're trying to do here is create their own food system for New York. And so that's local, it's healthy, it's encouraging local farmers and creating jobs and improving food security. We have also in Christchurch, of course, we have Christchurch 2.0, and there's a bit of work going around the local food system to try and improve it, which should encourage people to make real food choices. And in Auckland, we have Kai Auckland, which is a reasonably new group that's gotten together that I've just started to become involved with. And the idea again there is to think about what we can do to have a local food system for Auckland. And some of the features of these local food systems are that they tend to almost get off the ground, not by nutritionists. So it's about diversity, it's about involving all different types of organisations, because that's what a food system is. It doesn't just involve the people making the food, it involves all of those other different groups as well. So thinking about local farmers and fresh produce and food security and coordinating local food chains and all of that is beneficial, not just for nutrition and real food, but also for economics and our environment as well. And I think I wanted to finish this talk on a really positive note, because I think this is the same with Julianne's talk. It can all feel a bit depressing and a bit hard, and what can we actually do ourselves to make a difference? And I think this is somewhere where we can start. And of course, as a scientist and researcher, I'd be wanting to evaluate this to make sure it was making a difference, but actually the most important thing is just to get off the ground and start doing it. So I guess that's probably my final point for my talk. Yeah, just get out there and start making a difference if you can. Thank you.